Welcome to Deciphering Growth, the show that explores mental health from every angle. We bring you conversations with personal opinions, stories, and practical tips. We aim to break down the stigma and help you live your best life. So please sit back and let's dive in. Before we begin, we want to remind our listeners that this podcast represents the opinions of Tiffany Graves, Eric Stone, and the show's guests. The content provided is for informational purposes only and should not be considered medical advice. Please consult a healthcare professional for any medical questions. The views and opinions expressed are our own and do not represent those of our workplaces. Listening, reading, emailing, or interacting on social media with our content does not establish a doctor-patient relationship.
Right, we are back.
We are back indeed for another, I think, fun episode. I feel like we have some fun. We have some fun here.
Yeah, we're gonna throw maybe some spice around today.
Yeah, so today, it's a discussion around some of the things that were happening with CareSource, which is one of the insurance organizations in the lovely United States of America, and some things that happened here and really across the state of Ohio, specifically some behavioral health payments and reimbursements. Always something. But before we get started, Tiffany, anything you want to say around this topic?
I think it's very sore and sensitive topic right now still. I think even with them, deciding not to do clawbacks, it still has major implications for both providers and patients, clients. Like this is gonna I'm hoping something positive comes from all of this negativity, but it's going to hurt a lot of people in the process.
Yeah, it is. And I will get on just as to say, I don't really know if there's any trigger warnings for today. We're going to talk more about finances and like the systemic devaluation of therapy and how that plays out. But I don't think there's anything, just for those listening, I don't think there's anything we would get into today that would be particularly upsetting. But as we are recording this, it is the month of May in 2026. The state of the U.S. economy is very uncertain. It's a lot of pressure. There's a lot of stress. A lot of therapy and mental health providers have had a really tough 2026. There's always somebody having a good time. That's great. But as a whole, the economy is not doing well. So then if you go to the hierarchy of needs, Maslow's hierarchy of needs, you talk about physical needs first, like food, shelter. Do you have a broken bone? So those will be priority needs. And then you get into like emotions and safety and security, which would be most people view therapy in that lens. And I'm not saying it's not. Some people without medications and therapy will decompensate very quickly, but most people can function at some level without that. So you have a lot of people picking and choosing, even if it's a $30 copay and insurance picks up the rest, like saying, hey, I don't have that right now. I'm not able to do that. So that's very important to the landscape of things. Every year, insurance deductibles and things reset. And every year, probably the beginning couple months of the year, it's a very challenging time for most counselors in their own business or those taking insurance, because people are readjusting to having to pay, and that can be kind of challenging for a lot of people, unexpected. So the CareSource stuff ties into this because CareSource sent out letters to providers seeking recoupment payments because they were saying, they're saying there's an overpayment about 16 to 18% for behavioral health services, and they were going to recoup. Go
I'm gonna
ahead.
pause you there. Can we give people a rough number range of like what 16 to 15% is looking like for providers?
we cannot legally do that because it will get us into trouble. So if I say a specific reimbursement rate for therapy and that insurance pays me, it violates, I think your partner would be the one that could talk way better about this.
Yes,
It's like
I just
antitrust.
wanted to bring
Yeah.
this up to point out just how
Yeah.
many hands and feet are tied for us that, like, technically, legally, we can't even talk to each other about these
Yeah.
rates.
Tiffany couldn't tell me. And this is the thing, I can't even make up a number because it could be, but like, so I cannot say, Tiffany, the number I'm paid by any insurance provider is this. I'm not allowed to do that. It is a
Yeah.
big deal. I can't go on a therapist group and post that. I can't tell. It is in the contracts, and like you can get legal repercussions. So I don't mean to, but I actually can't even touch that, Tiffany, at
Yeah,
all,
no,
like
I
that
just wanted
question.
our
So
listeners to understand
yeah.
the dynamic of, like, how much insurance companies are kind of like duct taping us in terms of like what we can and can't do. Not only now are they coming back and saying you owe us money, but we can't even talk about money to begin with when it comes to them.
Yeah, I will say that a lot of providers are in network with CareSource to take Medicaid, and then Medicaid's rates are lower. They're not the highest paying, and I think people understand that. We're trying to offer services to go. So the thing I can say is, if it's, let's say it's not the highest paying rate, and then that's what you've accepted as a person of, okay, I want to help these folks. I want to help them get well. I am an in-network care source provider. I can say that. I can. To have that sent back, I wasn't nearly as impacted as other people. It was not a huge amount of the claims that got caught. It was like specific plans. Um, that was really discouraging though, still, of like, oh, I helped this person. I'm not at the high end of my rate. I'm not doing this because I'm making lots of money or driving a Porsche or for my third vacation home. I'm doing this because I want to help somebody. And it's not all about the money. That's not why we get into behavioral health. But to be very specific, like the reimbursement rate is not that high. So if you were an organization that was taking, or a group practice or a provider who did a lot of billing with CareSource, you could have been looking at thousands of thousands. There was some great advocacy. There's some great people who went on record putting their story out there of like you're talking maybe into the hundreds of thousands of dollars of what was
Mhm.
seek to be recouped. That's devastating. I mean, that amount of money, I don't know anyone that could just, any organization really in healthcare that could lose that amount of funding.
Yeah, it threatened to put a lot of people out of business and in really difficult situations. Um, I know some providers banded together and started a class action. I am unsure if that's still ongoing since they decided to stop the recoupment. Um, so it would have to follow back up on that. But it's devastating because some providers, as a result of kind of putting their foot down, saying, like, we're not taking this from insurance companies, have just decided to, like, stop taking CareSource. And that has major impacts on any client who was going to a clinician who accepts and has decided, like, yeah, I'm not going to accept this anymore because they're punishing us for trying to help you.
Yeah, I mean, a lot of people are looking to depanel. I am not one of those people, only because of like it will really impact some people I serve currently, and I don't want to have that. But it really does suck that feels like my passion for their members and care and concern for those members is getting exploited against me because this is not okay what they've done. So to just tie into the thing at large, like this does happen on a much smaller scale. Insurance companies may go back and be like, we don't like how you did these notes, or, this isn't right, or this code's not this. And like, that's been insurance. And so I'm not trying, like, it is the world that we live in. But I just want to say for a second that there are very few counselors that are out there and like, let's just make this up. Let's just pad this. Let's do this. Let's do that. Like our ethics are very clear. As soon as someone can be complete with therapy, I need to complete with them, fostering independence and autonomy. So it is, it's just, it's webbed in. us counselors aren't wanting to sit with someone and just go round and round for no reason. It doesn't feel good. That's not why we're in the field. But I think sometimes when we talk about fraud and abuse, there is fraud. There absolutely is. Those people need to be taken down and investigated and all those things. But there's just this idea of like how widespread it is, and that there's all of this. And it's not at the scale that gets discussed. And so that's what's discouraging. Is like, why is it so easy for people to believe, oh, this mental health care system is so fraudulent, so inefficient, so unhelpful? I don't know. So I find it really, really discouraging that like so many people in government or at whatever level think what we do is not real, what we do is not important, and are constantly seeking to create more and more barriers.
Mm-hmm. Yeah, it is kind of disheartening that because it's not large enough in scale in some regard, large enough in my opinion, but not large enough that like something like an actual reprimand is going to happen. It's going to be more of like a soft, like, ah, that sucks.
Yeah, I just and then it sounds good to be like, well, we save taxpayers all this money, and it gets political, and I mean it's happening all across the country, not just Ohio. So I just thought it'd be nice to tie it into the bigger context of things going on. Um, for one, we could talk about like a legal case of Parity Act. Like, why is it mental health and substance use counseling services that keeps getting under attack? Why are we not looking at all other types of services with the same level of scrutiny? Um, the challenge that I get concerned about is the harder you make it for counselors to work in this system with healthcare insurance, some of them will literally just not do that and then go and be cash pay only. And so the thing that I fault none of my peers for doing this, to be very specific. It's we're all making our own choices. So one path is, this system is oppressive for my patients. This is oppressive for me, and I'm not going to live in it. And I will take this rate of cash only and be over here and not have to mess with it at all. Like, that's something people can do.
Yeah.
Another is like, well, I don't know if I can do that. I don't know if my business will survive. I don't know if I can. Let me go in and take insurance. So I'm not judging either, but I do just want to speak that the more people that keep believing this, the healthcare system essentially, and go to the side, or, hey, we're concierge or doing this, typically those are the most skilled providers. Those are people with specialized training, working with specialized populations, like eating disorders with teenagers, um, bipolar, medication management. Like, so they're very needed skills. Like, these are not skills that typically can be very quickly replaced, where it's like, oh, there's like 30 people in Cincinnati doing this niche with it. That's usually not the case. So
Mm-hmm.
it creates this pressure on those who are still in the system. There's more people there that can be served, or less specialized treatment. And if you're getting less specialized treatment for a specialized need, that's not going to match up with the level of care you're looking for. So you're going to get less quality care. You're going to get less quality outcomes. And so then we all know there's gaps in healthcare. These get worse the more these skilled providers keep leaving the system and not staying, or not um, wanting to
Yeah.
be a part of it.
And that contributes to what some of the clients that we've worked with, or in general, what you hear quite often is like, I have to wait 6 months to a year to get into a therapist. And it's because of these like funnels that is unintentionally and intentionally created with insurances and how they treat people, where providers like, yeah, I don't want to work with insurance, which limits accessibility, and so you're waiting long periods of time for the people that are willing to work with insurance, and that puts a lot of pressure on those very few clinicians.
It does. And then you have like people who then, like, I don't want to keep eating my own. This is the way I feel. Like, I'm sick of the infighting with fellow social workers and counselors and LMFTs. We're all on the same team. And so I don't need to be fighting with people making different decisions than me just because they're trying to survive. But this happens like I think as a field, we attack each other a lot, and we make it like, well, if you're not making the same decisions I am, you're against me. It's like, no, we're just making different decisions. So whether I want to go into nonprofit or for-profit or group, solo, hospital, VA, whatever, like that's my business. That's my choice. It's your choice, Tiffany, to do what you're going to do. But I think we like police each other, and beyond ethics, it really shouldn't matter. But it's people are trying to survive, people trying to get care, and we're trying to help people in our community. But it's just the system sucks. Like it really sucks. Like I have a daughter. If my daughter needed something, I'm going to try to get her to the best care, figure it out. And if the best care had no one that took insurance, that would be tough. But that is really almost what mental health is like a lot of the time. If you're looking for that specialized counselor with those skills, a lot of the time they're taking a few insurance panels, not all. Like our system is tough, and that's why we have virtual tech startups who have come in and they're like, we're going to panel you with all these insurances, or we'll do this, we'll do that. Well, the insurance companies own these companies. So it's kind of like they've created another lever and making it where you have to go through that. So it's just very messy in mental health. If you're a person consuming mental health services, do you need to know all this stuff about the business? No. But the system is very, 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 very broken. And so because of how broken it is, a lot of things can come in, and we're just a very open industry to having things come in and set the stage, and I don't want to say take over, but take part. So there's coalitions, like I know there's like a specific Ohio counseling subcommittee that is about in healthcare insurance and what's going on and rates, and they're sharing some things publicly that providers are getting notices of rate cuts, like what CareSource was doing at smaller scales, not allowing new providers in. And so, I mean, just kind of understanding that healthcare insurance is there to manage costs. They're not there to make sure you have care. They're there to manage the costs. So they have like an incentive for you not to get therapy, believe it or not. They have an incentive for you not to go. And I think some of this is rooted in therapy as an ongoing thing versus a surgery is hopefully a one-off, but there's just a big incentive for them to attack the cost of therapy.
Mm-hmm. It just hurts my heart when you say it out loud of like the
Yeah.
system is set up to just not be beneficial for therapy.
No, I mean, all this, well, let's also maybe all of this insurance stuff, which panel, all of that is happening before you ever go on Psychology Today, go online, ask somebody who's got account. All of that's already happened before you ever even look. And so that's steering things. So, you know, and I don't want to, I'm not trying to, I want to make sure I'm not throwing shade on counselors taking insurance panels. I'm not like, hey, they're all terrible. Like, that's not what I mean to say. Like, there are many, many gifted clinicians that I know who take insurance and are super passionate and are making choices, but a lot of them are making those choices because of some values they have and passion, not because it makes the most economical sense for their business model, or even for who, like, they're doing that because they believe in that themselves. And so that's what's really crappy for counselors right now, is like, you want to serve your community, serve people, but to do that, you're having to deal with some real nonsense from insurance companies. And so the argument and discussion is it doesn't need to be that way. So this CareSource moment has kind of come in as this like rallying cry of I think, I don't want to speak for all our fellow healers, Tiffany, but just feeling pushed all year, push, mental health as the scapegoat in a lot of things. And this just kind of woke, at least in Ohio, it woke a lot of people up. And like, I think a lot of us got into like lion mode, and started talking to the news, starting putting things out, starting to rally and work together in the ways we legally could. There were protests at some of the CareSource offices several weeks ago, local organizations, grassroots coming together. And so right now it's hey, we're not going to put up with this anymore. We're not taking this, and talking to our political representatives, because you want great care. You want people to want great care. If you look at like a master's degree and the level of training that a counselor's getting for the rate of pay and education, it is not even close to the highest. It's really genuinely not.
Which that is one thing that has always frustrated me. I'm like, where do they get these highest numbers? Like, who is skewing the median for us?
Well, if you provide cash pay only, therapy in the great state of California or New York or Hyde Park or something, like,
This is
that's
true.
that's
Yeah, that's just
aggregated.
so unfair.
Well, it's just that everyone deserves quality health care. And so, I mean, there will always be gaps. There's no way we can not have them, but there's obviously ways we can close them. So that's kind of some of the context, but I think just kind of explaining, like, therapy has been devalued for a really long time. And if I can be a history nerd for a moment, if you look at like the patriarchy and when skills are deemed to be feminine, air quotes, then they are devalued. But when they're seen as having some kind of value, they're masculine. And a great example of this, there was a great article in Psychology Today about this a couple of years ago, is bookkeeping. So back in like medieval times, that was not seen as a masculine skill. And I'm not meaning to label them. Once it was seen as a value, oh, that's not something women do. That's a masculine skill and that should be a men and there's value in it. And so therapy is caught in this weird, strange moment of, if you look back to like the 1970s, like we've kind of been exploding. We're a very young field, honestly. So you see how we're getting more value, but then there's more value in therapy. Well, then, okay, what does that look like? But it hasn't really translated to compensation. And then when things get tough, which I totally understand things are tough right now for a lot of people, we kind of get pushed to the side. And the combo I have is, if you have there's only $10,000 to put aside somewhere in the community for a need. I mean, there's more than this, but do you put that towards addiction issues, counseling issues? Do you put that to fire, police, homelessness, housing? And those are the decisions that are happening. And so I think more often than not, sad to say, that mental health funding is what's getting cut. And that literally just happened at the beginning of the year. There was an evening, a bunch of emails went out and millions of dollars were recalled, and different grants to different organizations just overnight. No change, no warning. Hey, we're pulling this money back. So I think it's like we have to kind of start advocating for ourselves, telling these stories. And I know, Tiffany, that's part, not specific for insurance, but we wanted to demystify therapy and kind of bring people together a little bit, because there's just been a lot of nonsense the last couple of years
Mhm.
around counseling and access to counseling.
Yeah, and not really understanding the reason access has gotten so funneled and why people I understand people's frustration of like, oh my gosh, it takes me 6 months to get into this facility or see a counselor in general. And it's like we gotta understand that the system is like it's in, as you mentioned, and it's in its young stages, trying to figure like the system, the workers are trying to fight for like compensation that is fair, that can help us provide the best quality of care. But we have the other half of the system that like people are willing to, and understandably for personal reasons, engaging in, which creates this like really split dynamic of like, if you can afford the luxury of private pay therapy, then you can afford to take care of yourself. If you can't, then you're waiting and potentially waiting for things to get worse. And it's a really unfortunate dichotomy.
It just is. And I don't want to say there's no end in sight, but it's just not very positive. It's just not. There's not a lot of positive things on the future. And as we look at like reimbursement rates and things, like I was at a counseling class and and the students were like, why are there not more like peer support services? And they asked me like, why are more people not doing that? I was like, well, honestly, it's because the reimbursement rates are not the best for those services. And I was just kind of saying, like, sad to say, like, if the reimbursement rate changed by any level of significance, you would see way more access. And folks don't. So it's this real tough thing of like, who's getting the increases? What are we doing? Where's this money going? Where are the resources? And there's so many needs. So, I mean, I want us to have, I don't know, locally, I want there to be great cancer treatment. I want there to be great mental health services and emergency services and how, so it is very complicated. I think you got to worry. I think there has to be some look to the future of like, where is this going for mental health? Like, what all these needs can be tied into mental health services, and you just have to be careful. The thing that gets me very frustrated is when there's an emergency like a shooting or someone has a mental health crisis and does something that's like, well, this is a mental health issue. I will have to say my patience thins every time there's another instance, and there keeps being other instances, because it's like, well, what are we doing about that? Okay, it's a mental health issue. What are we doing to make sure that that person got care, got access? What did we do? What did we learn from that? Because if not, it's just we're doing the same thing. So mental health can't just be the new thoughts and prayers. Well, really, really need to find mental health for them. It's a mental health issue. Well, what are you doing to make sure everybody in your county and your community has access to mental health?
Mm-hmm.
I'm going to bring it back to insurance for a second. Like, the harder this is for people to get access, the worse things get. They really honestly, like, if you're having mental health issues or trauma, the sooner you could work on that issue, the sooner that could be worked through, processed through, the less trauma you will have, the less heightened outcomes you're going to have for the need for further mental health services. So, like, they would actually save money if there was access. It would not take us this long. Like, I don't know about you, Tiffany, but if I get to work with someone that's very recent trauma exposure, they're in counseling, I can make very quick work of that because it hasn't gotten to pick up other things and create more dysfunctions or non-adaptive responses that create further issues and issues and issues and issues. So I don't, however they're spending it, it doesn't make sense to me at all.
Yeah, it is a really curious thing of like, where is it going that you're okay creating these access issues? Like, yeah. It's one of those things that, like, maybe it's our neurodivergence, where it's like there's this thing that could easily help solve this problem. What's the logic we're not doing the thing? And kind of having that frustration of like, the system clearly isn't working. What's the reason we're not making changes to the system?
Yeah, that's probably a different podcast. I know. What can you do? What can you do as a person is just like, be informed of this, be aware of this, pay attention to those stories. News organizations sometimes are like, oh, these mental health feel good stories or success stories, they don't get a lot of views. I mean, I'm just being honest. So, like, the more we engage with stories like that, the more we show, hey, there's this demand, this hunger to hear about what's going on in the systems and understanding and going, that benefits all of us. Like the public scrutiny of that. CareSource, we need to make sure we include this, Tiffany, walked back seeking the recoupments. They said they put it on pause. Now there's a fight for them cutting the reimbursement rate. So that discussion is ongoing and happening. But that doesn't happen unless everybody gets together, puts the pressure, and says enough is enough. And it still will impact CareSource's bottom line for the foreseeable future, like people leaving providers, maybe even people not choosing to have them manage their care. Honestly, like, I don't know, but that has an impact. And so I think when we come together, we can have a huge impact. When we unite as many voices into a collective, we can make a huge impact on our communities or impact issues. And so that's why Tiffany and I are here. I know people listen to what we have shared. It's really encouraging, but we thought this would be helpful. I just think about some of our recent episodes, Tiffany, we've talked about healthcare trauma. We've talked about financial trauma.
We've talked
about all these different types of trauma. And so, like, for us, this is just such a natural progression of like, this is completely relevant to what we've been talking about, really the mission of the podcast of like, how do we challenge some of this trauma? Because it sucks. It sucks. It really sucks. Someone calls me and says, hey, do you take this insurance? And I'm not. Well, the reason I would not be taking an insurance payout is because the reimbursement rate's terrible. And it doesn't work for me as a person to do that care. Like, that could be I mean, I'm not going to say which one. I'm not. But there's the one. And people are always looking. It's always this one panel that people are looking for providers for. And you know why everybody's looking? Because they pay terribly low for what they could pay. So no one takes them. And it is constant. I mean, it is constant. And it's like, someone's like, well, that's a business opportunity. Like, yeah, but you're going to be capped.
Work yourself to the bone.
Yeah, but it's like, yes. And no, so again, not judging anyone for taking that panel, but that sucks. Like, that sucks. Like, I just remember someone locally was like, hey, Eric, I need help finding for my kid therapy. I'll leave it that broad. They had this panel. It was very difficult. It was so difficult. It was so difficult to find therapy for this person. And it was like a really urgent thing. Like, this was a very urgent thing. It was like a crisis level thing. They needed to be in the hospital, but they needed ongoing care. Couldn't find anyone for a month. And I'm like, I mean, I don't mean to say like, but Tiffany, we know people. Like, I can call people like, hey, what do you got? Hey, like, I can get around some of the, stuff. And even I was like, there's just literally almost no one who can
Yeah.
help.
Yeah. And I wonder if that is the future for CareSource that it's going towards with its decision to, want to try and recoup, even though it's on pause now. Like, we don't know that it won't resume, or they're slashing like payouts. Like, at what point does it get to a point to where people are like, fuck them?
Well, a lot of people are already there. A lot. A lot of people are already there. Yeah, I appreciate the chance to talk about this. I think if people have more questions, or it's like, obviously Tiffany and I are very passionate about this. We talk a lot about this off mic or in our free time. But
It's a
it
lot of just
impacts care.
yeah, it does. And
Yeah.
it's financial trauma, it's access trauma,
It
it's a
it just
healthcare
pisses me
trauma
off.
all wrapped in one, because I can only imagine being that client seeing a therapist and they're like, "Hey, unfortunately, I've decided to no longer take your insurance." And like, what if they've been working on significant trauma for 1 or 2 years?
This happens
It's
every day for someone. Every day.
it's so like so disheartening that insurance essentially has like therapy by the throat, and they're like, "You do as we say."
Right, because we're devalued, and so it's an easy way for them to skew some numbers for them. It just upsets me because I fundamentally, as a person, believe doesn't matter what your economic status is, your value as a human is equal. And that is not the experience that people are getting with therapy. So there is this like, oh, I'm on Medicaid, but you have this much access to care. Not, it is so frustrating. And then the other end of this is because of how fucked the insurance system is, the middle class folks, whatever you define that as right now, keep getting pinched. So there's like, at least if you have Medicaid, you can get services no cost to you. But if you're in the middle class, like if you're paying for your family, you have your own, I mean, you may not even be able to afford to use your insurance if it's that, and so it's just so fucked. And it's not serving the consumers. It's not serving the providers. It's not serving those who have it. So the question is, who is it serving? And that's where the frustration and tension and that collision is at right now. Like, who is serving from this? A big, great question that was getting asked, where is that money that's getting recouped going?
Yeah, like
Where is that less fee reimbursement? Where's that money going? Because it wasn't to get more access to care. That wasn't done to make more access. That's like, okay, we'll probably lose this percent of providers. That will save us this, if we even delay. I'm sure they know. I'm sure that, well, the longer it takes for someone to get in, we save this much money. I'm sure they know that.
I'm sure, but like, isn't that not frustrating essentially that there's a system that's saying, like, how can we fuck over enough people that we can save money? We don't care
And
about the
make
people
more money.
and make more money and care 0% about the people they actually are supposed to serve or should be serving.
Well, I just fundamentally can't get with it. I don't think that someone in Hyde Park is more deserving than someone in Middletown of access to quality care. I think they should get the same experience, and we know they're not. And so how do we fix that gap is what I'm really passionate about. So to be clear, I want the who's in Hyde Park to get the same quality. I want to raise that quality for everyone. But when we have things like this, that's not what that's doing. That's one more barrier, one more layer. And if you just think about things like counseling, sometimes it's really hard for people, even with like all the work we've done on stigma and it's okay to go get help. There's so much stigma in so many communities and different groups around going to counseling. So then if you have that window where you may be open to counseling and you hit all these walls of bureaucracy, happens every day. People are like, I can't do this. This is too hard.
Yeah.
I work in it and it's still fucked. Like, it's still fucked to try to figure this out. It's not a linear progression at all. It's really, really genuinely not.
Yeah, it's really such a, it's like whack-a-mole. But the whack-a-mole explodes, so it's like, do I hit it? Do I fight it? Do I go with it? What is my what kind of move can I make that actually is like helpful for people involved?
It's always something.
It is. It is. And it unfortunately impacts a lot more people than sometimes is recognized.
Well, thank you, Tiffany, for letting us talk a little bit about this. Anything else that you have? I think I've actually covered most of actually everything.
Yeah, no, I think this sums it up. Like everyone's frustration with CareSource's bullshit. And I think we're probably going to see a lot more individuals moving away from taking CareSource, which is my hypothesis is it's going to make the funnel for care where people that do accept insurances that much more backed up. You're going to have that much longer of a wait for services. And it's
Well said.
disheartening and sad. Yeah.
Well said, Tiffany.
Yeah. But otherwise, we thank you guys for joining us as we rant about CareSource's stupidity. Hopefully we don't get legal action for calling them stupid.
No, I think we're just saying like this doesn't work.
Any wrap-ups from you, Eric?
Yeah, appreciate you all listening, and we'll look forward to getting to talk a little more about something else, but thank you all for being here.
Until next time.
Thanks for tuning in to this week's episode of Deciphering Growth. We hope you found our conversation helpful and insightful. Subscribe to our podcast for more episodes and check out our Patreon for more content. Don't hesitate to contact us on social media if you have any questions or comments. We'd love to hear from you. Until next time, keep growing.